healthcare is not immune to disruption. In fact, there's a lot of transitioning now from people's understanding of payer-centric care and provider-centric care. Now people are starting to talk about patient-centric care, but even beyond that is patient-driven care. And I think that's where a lot of the interest in what we do and being able to model the future comes from. And in patient-driven care, you have people who now, much like Uber, have access to their own health data, to their own genomics. They are using that to examine who might be the best hospital, what might be the best course of treatment for me. And the healthcare system then becomes a support. And the systems involved in that support are very different than the acute care and diagnostic care and lack of choice that people have now in the market. Another aspect of what we do in healthcare is also to help people examine the flows and the process of their workflows, whether or not that's looking at x-ray departments and when they may need to bring on more staff, what conditions in the environment trigger that need of external resources. And more than predictive systems, we can actually help them play out and learn to build adaptive systems, because the future is never predictable, and that we know by now.
So in terms of cost efficiencies and also work efficiencies, applications that using model simulation can help administrators to understand this with far more clarity.
Exactly. And we can tie economic and transaction models to these simulations so that as they optimize or trial new technologies and flows, they can see all of the economic impacts, the impacts for their staff, the impacts for their staffing costs, as well as their facility costs, and even understand the impact of policy. So let's not forget that health providers operate in a policy environment, and they need to learn how to become more efficient in that policy environment, but also be able to get ahead and react and respond when policy changes.